I'll begin by washing my hands. Then I'll make sure I have all the equipment that I need. I've got some sterile water, a suction catheter kit, a drape for my patient, an ambu bag, a portable suction pump, a mask, some gloves, and my patient is wearing a pulse oximeter. I will begin by identifying my patient. So I'll go to my patient and I will look at their wristband that they have, and I'll ask them their date of birth and their name. Once I have confirmed that this is my patient, I will assess them. And then I will check their O2 stats. I will also explain the procedure to my patient. My name is Megan and I'm going to be your nurse today, suctioning your trach. If at any point during this procedure you are uncomfortable or you experience distress, just raise your hand and I'll stop. I'll drape my patient and I'm going to test my suction. For a portable suction pump, it needs to be between 5 and 10. And it's at 10, so we're good. Next, I'll put on my mask and my gloves and I'll get my supplies ready. With an already opened bottle of normal saline, I'm going to check the expiration date to make sure that it is not expired, and I'm going to lip the container. Then I will open up my sterile pack and I will remove my basin, and I will make sure to use the same part of the bottle that I lipped and not let it touch the basin. Fill it with a little bit of water. Next, I will remove my clean gloves and I'll put on some sterile gloves to set up the suction pump. And then I will grab the catheter and I will take it with my dominant hand and I will roll it into my fingers to ensure that this does not become contaminated. And I will hook this piece to the suction, and this hand's going to become contaminated. Like so. Now, I will test my suction in my water to make sure that it is working. And it is. So now I will go to my patient and I will hyperoxygenate them if they are not wearing this collar already for 30 to 60 seconds. Since they're already wearing their collar and their O2 sats are good above 92%, I'll just move it out of the way. And I will insert the catheter 4 to 5 inches. Unless I meet resistance or if the patient coughs, and then I will withdraw and assess my patient. I'm going to occlude the catheter and come out in a circular motion. And I will do this for no longer than 15 seconds. So after I've suctioned my patient, I will listen again. And by assessing my patient a second time, that will determine whether or not they need to be suctioned further. At this time, my patient sounds good, so I'm going to replace their oxygen, and then I'm going to remove this. I'm going to wrap this catheter up in my glove and pull it off with my catheter completely in my glove. And I'll take it in my other hand, pull it off here, and then I will put it into a red bag. Then I will be able to clean up my field. I will put on clean gloves to remove my mask and my gown, and to clean up any of the items that I have used for this procedure. After I clean up all of my items, I will document breath sounds. I will document the color of my patient, how they tolerated the procedure, and their O2 saturation before and after.